Spinal decompression. Spinal decompression is mechanical traction that is performed by a specialized decompression table just like this that will pull and release and pull and release either the cervical spine or the lumbar spine. This type of treatment is often very successful in helping patients that have had problems for a long time with little success from other modalities. The table is controlled by a computer that controls the force that is put through the tissues that can help a variety of conditions. When a patient is under cervical decompression or lumbar decompression treatment, what is actually happening is the spine is moving, and that is stimulating the mechanoreceptors that can help reduce pain. It stretches all the tissues involved, the discs, the ligaments, the muscles, the nerves, and the joint capsules. It creates an oscillation movement in the joint that can help increase range of motion, decrease inflammation, which helps heal tissues but also helps reduce pain. The benefits of spinal decompression are to decrease pain, decrease muscle spasm. It will help with nutrient exchange in cartilage and discs. It helps improve lymphatic flow, and it improves motion and movement. These are all contributing to decreasing your pain and increasing your quality of life. We see significant improvement clinically in patients that have degenerative disc disease, lumbar or cervical disc bulges, central or lateral stenosis, either from a disc bulge or herniation or from bone spurs. Another benefit we see in patients is when you have a chronic muscle spasm, it helps reduce that spasm. We see a tremendous amount of help in those patients that are just generally stiff and tight with very little movement in their spine. And finally, one of the things I love about having spinal decompression in our office, spinal decompression seems to help in those stubborn cases. How do you know if you're a candidate for spinal decompression? Well, it starts with a very thorough exam and the appropriate diagnosis. Symptoms you may be experiencing that could indicate you might be a candidate for spinal decompression would be things like burning sensation, pins and needles, sciatica pain down your leg or a pinched nerve down your arm, numbness and tingling, weakness in your limbs due to pinched nerves, and or if you're that extremely tight person that's had chronic pain where nothing else seems to work. Those are symptoms that it could indicate that spinal decompression could work for you.